Hi everyone. My last few videos I've talked a little bit about gynecological conditions and menopause. So today I want to talk a little bit about Chinese medicine's approach to pregnancy and specifically postpartum care. So in China and in Taiwan there is the tradition of the Zuo Zi Yue, which is the sitting month. What that means is that after a mother gives birth, there are 40 odd days where she does absolutely nothing except relax and nurse the child. So that means no cooking, no cleaning, no real physical activity of any kind. Ideally, you stay in bed, you nurse your baba, and you take a series of different Chinese herbal medicine formulas. And this is designed basically to aid recovery. And I think it's a beautiful concept. I think it also makes sense. I think, to be honest, the way women in the West, I think, particularly in Ireland, are treated postpartum is pretty awful. The fact that you're brought in, you're given your chemical induction, and then you're booted out the door. With no major aftercare of any kind and expected to get on with it. After everything that giving birth entails, I think you need a bit more care than that. So the Chinese herbal medicine approach to this, like I said, there are 4 different formulas. The first formula is almost like a soft tissue damage formula. It contains a lot of herbs we would use for trauma, for like martial arts injuries and stuff like that. So what this is designed to do is just facilitate healing after the act of giving birth. The second formula then is a tonic. It's designed to build the mum up, but it's not particularly energizing. You're just kind of meant to chill out, take it, and it'll build you up a small bit, but you're not ready to kind of get up and go yet. The tonification it's doing is kind of meant to be focused inward and not outward, to have you be more productive or whatever. The third formula then is to do with what we refer to as water metabolism in the body. So what this is, it's working on kidneys, it's working on lymph. It can also be modified to work on lactation as well. So any kind of swollen ankles, any urinary difficulties, anything to do with the kidneys, the lower back, or production of breast milk, this formula works on that. And then the final formula is quite like the second one. It's another big tonic, but this one does have a few herbs in it there to kind of get you a little bit motivated, give you a bit of get up and go. And this then is designed for you to finish the Zuo Zi Yue, finish the sitting month, and reintegrate. And hopefully by that stage, we've done a pretty comprehensive job of healing the soft tissue damage caused by birth, and then kind of regulating the system, building it up, and then kind of sending you on your way. A lot of the herbs that we use in these 2 tonic prescriptions are what we call blood tonic herbs, and the Chinese medicine conceptualization of blood is a bit different from the Western one, but a lot of these herbs do have the ability to tonify things like iron. What Western medicine would call anemia, we would call blood deficiency, or liver blood deficiency specifically. So, obviously after a lot of blood loss, you hear of women getting transfusions and so on. This is can be thought of as something like the herbal version of that. So this is our approach to aftercare in Chinese herbal medicine. I think it's incredibly important, for a lot of reasons. For the continuation of the human race, it's quite important to take care of mums. But also, as a clinician, I see so many women come into me with issues that can be traced back to a difficult labour with inappropriate or completely absent aftercare. And those issues can range from the musculoskeletal to like sacroiliac misalignment and lower back traumas, and it can be on different systemic levels in Chinese medicine related to like being depleted after giving birth and going straight back into work, and it can be emotional as well. So an absolutely vital part of health for women, which I think would be great if we could do something a little bit similar in this country. But if, you know, after giving birth is also a really good time to take a break and to boost the body. For some of my long-term patients, I don't personally give a lot of herbs during pregnancy. Some practitioners do. It's kind of a specialized area. But what I'll often do is for people with chronic conditions, immediately after they give birth, we'll bring them back in and they'll do quite an intensive course of herbal medicine, and it can be a really good time for healing, not just for building you up postpartum, but for working on underlying conditions as well. So that is the Chinese medicine approach to postpartum care. I hope you found it interesting. Thank you for listening.